I'll make a start. Hello everyone and welcome to today's open event where we'll be looking at our exciting postgraduate programs in nutrition that are available here at UCL. Thanks very much for joining us today. My name is Kate Thomas and I'm the Events Officer for the Faculty of Medical Sciences here at UCL and your chair this afternoon. We're hoping this session will address those course-specific questions you may have and will also help to give you an insight into what it is really like to study nutrition here at UCL. So this afternoon, our speakers, Nathan, Paul and Anastasia, will provide a summary of our exciting postgraduate programs, and there will be a Q&A session that will include one of our former students, Sarah, so there will be plenty of opportunities for you to interact with us throughout today's session. This session is being recorded and will be made available on our website following today's event. We're here to respond to your questions, so please share those throughout using the Q&A function on Zoom. Now to introduce our speakers, we have Nathan Davis. Nathan Davis is Professor of Biochemistry and Head of Education for UCL, for the UCL Division of Medicine. Professor Davis is a registered nutritionist and head of education for the division. He is also program lead for the clinical nutrition and dietetics programs at UCL and teaches extensively on biochemistry and metabolism. Professor Davis is also a noted researcher in liver disease and has developed several novel therapies that are now in clinical trials. And Paul Robinson. Dr. Robinson is a consultant adult psychiatrist and has specialised in eating disorders, psychiatry for over 25 years, working at the Maudsley, at Johns Hopkins Hospital, Baltimore, the Gordon Hospital, the Royal Free Hospital, and now as a researcher at St Anne's Hospital in North London. He is a programme lead for the Eating Disorders and Clinical Nutrition programme. And Anastasia Kalia. Dr. Kalia is an Associate Professor at the UCL Division of Medicine and an Honorary Associate Professor at the UCL Institute of Cardiovascular Science. Anastasia is the course lead for the Obesity and Clinical Nutrition programme. She has over 20 years of research and teaching experience in academic institutions in the US and in the UK. Dr. Kalia is a registered dietitian and a member of the Board of Trustees of the Nutrition Society. Her research interests focus on diet, metabolic inflammation, and cardiometabolic diseases. And we do have a former student, Sarah Etamadi. Sarah is a former student in eating disorders and clinical nutrition here at UCL. Sarah will be joining us for the Q&A segment. So please submit your questions that you have for Sarah and for our speakers via the Q&A function. Thank you all for joining us today. But before I hand over to Nathan, I'm just going to share a quick poll. So if you could just let us know what course you are interested in applying for. So the options are the Clinical and Public Nutrition course, Eating Disorders and Clinical Nutrition, Obesity and Clinical Nutrition, and if you're not sure yet, there is an option as well for those, and hopefully we'll be able to help you to decide by the end of the event. Okay, great. I can see that we've got a couple of responses.
Hopefully that's working for everybody.
Yep.
Yeah, great. Okay, so welcome to this open day where we're going to talk about nutrition programs. I've got a general overview. I'll talk a little bit about the clinical and public health nutrition program, but really I'm talking sort of generally about our nutrition programs where our colleagues will sort of talk more about the specifics of and specific differences of their programs in a little while. So why would we want to study at UCL? Well, we've got lots of statistics, lots of facts and figures that support that this is a great place to come to. It's a great university. We are highly regarded around the world. We are always in the top 10 of the QS World Rankings for universities. and we have a very strong research profile and a very strong research portfolio. We are currently 5th in the world for scientific papers, and in medical sciences we rank even higher. We have the best academic student ratio in the UK, and we were also, well, certainly before Brexit, we were the best performing UK university in EU funding schemes. We have a very good track record for employability, as you can see here, and also studies show that UCL graduates earn a premium compared to graduates from other institutions. And we are the 2nd most cited university in Europe, which is really quite an achievement considering that UCL is unusual in a lot of compared to a lot of UK universities in that we have such a broad spectrum of courses and programs. We pretty much cover everything except music. We don't teach music, but pretty much everything else. Just to say that the Clinical and Public Health is an accredited program, so our graduates are eligible for direct entry on the professional register of nutritionists, and you'll also find that the Eating Disorders and Clinical Nutrition program that Paul Robson will talk about is similarly accredited. I said that UCL generally has a very good track record for employability. This program does as well. So the most recent year that figures are available was 2018, where students registered in 2018, completed 2019, graduated 2020, and then this survey is conducted 15 months after that. So of our responders, we have nearly 95% of our graduates who are employed or in further study at the point at which the survey was taken. And you can see that they've gone to a wide variety of occupations. One of the questions we always get is, what can you do with this degree? Well, you can see here that people have gone to do PhDs, have gone to do other masters, they're working in companies, all sorts of companies, including major multinationals like Procter & Gamble and L'Oreal, as well as lots of other types of companies as well. So we do structure our programs to give you, the best possible set of skills to help you get on in whichever career direction you wish to take. Why would you study this program? Well, the program is comprehensive. It has a holistic view of nutrition and the impacts of undernutrition, overnutrition, and malnutrition. And we define these, malnutrition being wrong nutrition and not necessarily just undernutrition. There's lots of different reasons for this. We get into them in the course in lots of different ways, and they have global impact, both at a society level and very much at an individual level. And we've got very strong track record on this. We are world leaders in nutrition research, obesity research, but also in child health, epidemiology, and psychology relating to things like disordered eating. So we really do have the experts, the people who quite literally write the books on this subject, work at UCL, and they come and talk on the program. One thing it's not is it's not a food science course. If you want to know how to make better biscuits or nicer ice cream or whatever it happens to be, there are plenty of programs out there, but it's not what we do. This is very much about clinical nutrition and the impact that it has on health. Why nutrition? Why nutrition at all? Why is this a subject that we're interested in? Why should you be interested in? Well, the key thing is that everyone has an opinion on this. Everybody has to eat. It's not something you can avoid. Other things that we do on a day-to-day basis that potentially could cause us harm, such as drinking alcohol, smoking, whatever, you can give those up and it doesn't necessarily have a massive impact on your life. You can't give up eating. You can't give up the daily ritual or the daily requirement for nourishment. And making sure that nourishment is the best it can possibly be is one of our goals. And what you eat has got a greater impact on your health than anything else. It will literally have an impact on how well you live and how long you live. It affects how you grow and develop, the likelihood of developing disease, and your overall lifespan. And all of the factors we talk about overnutrition, undernutrition, and malnutrition have got impacts that can lead to premature mortality. We have a long track record of nutrition research at UCL. This gentleman, it was Professor Jack Drummond. He was notable for a number of reasons. One is that he was a discoverer and a person who isolated vitamin A. So he was the first identifiers of vitamin A. But more importantly, at the point of the start of the Second World War, when it was perceived by the government that there were going to be problems with feeding the population during the war, the government came to Jack Drummond and his team, and they asked him to devise a system for making sure that the nation stay healthy. And he did. So Jack Drummond and his colleagues developed the ration system. And here we've got an example of the food ration as it was in 1940. And you look at this and you think, actually, that's not a very healthy diet. If you look at margarine, sugar, cooking fat, butter, bacon that's more fat than bacon, and we perhaps look at that with today's eyes and say, well, actually, that's not very healthy at all. However, you have to consider this was used very sparingly. This was a week's ration, not a day's ration. When you spread this out and you supplement it with unlimited amounts of fresh fruit and vegetables, because people were encouraged to grow their own, then actually it becomes incredibly healthy. It's fair to say that the British populace was healthier while they were on the ration during the war, at least in terms of their nutrition, than they have been at any point since. If we could return to a rationing system and limit the amount of fat and meat and things like that people were eating, we would cure an awful lot of society's food-related malnutrition at a stroke. And what do we mean by malnutrition? Well, malnutrition, as I said, is wrong nutrition. And we know that there's an ongoing obesity crisis. So if you look at the stats the government puts out, in 2015, 2/3 of adults were overweight or obese. And if you look across this scale at the bottom, out of every 100 adults in England, you can see that we have a portion of underweight, a minority that are healthy weight, and then the majority that are overweight. What do we mean by malnutrition? Well, quite often we talk about things being calorie rich but nutrition poor, and that's the problem with an awful lot of food that's consumed in this country. It's not just in adults. A lot of the problems start in childhood, and we can trace back a number of health conditions that arise because of poor nutrition in children, particularly in school children, and the trends are there even before children get to start school. You can see here in this bottom left panel that of every 400 4 and 5-year-olds, a lot of them are starting school overweight or obese, and that's something that we should be concerned about. And this costs us. It costs us as a country, it costs us as a society, and it's not just in the UK. This is pretty much every developed nation and increasingly all the developing nations as well. So in this country, obesity, it's just obesity, costs the wide society around about £27 billion a year. That's all partly in healthcare costs, but it's also in lost work days and other community support measures that have to be put in place. And this is a slightly startling statistic to say that we spend more each year on the treatment of obesity than we do on the police, the fire service, and the judicial system combined. One of the concerns that we have is that obesity is intrinsically linked with diabetes, but it's not so straightforward. Not everybody who's obese has diabetes, not everybody who has diabetes is obese. And it gets a little bit confusing at times. And we have to sort of think about what the reasons are, what the metabolic consequences of obesity are and how they impact on diabetes, and why isn't everybody affected in the same way. There's a lot of genetic components, there's a lot of epigenetic components. This is the way the environment impacts on your genetic code and the way it's expressed. But it's a complicated issue, and we sort of try to get into some of the detail about it and explain what's going on. And this figure on the right-hand side, again, just shows the prevalence of diabetes in the population, and as obesity is increasing, it is moving up stepwise with it, which is, again, something that we should be concerned about. As well as having lectures and discussions and visits from notable people, we do a load of other things on the course. We have get involved in lab practicals, so understanding how to measure the body and how energy expenditure can be determined. We go through all of this. We also organise visits. Haven't had so many visits for the last 2 years for obvious reasons due to the lockdowns and pandemic, but with things returned back to normal, we would expect to see our students going to visit hospitals. We expect them to go and visit places in the community. They go to visit charities. It's about seeing how nutrition is enabled in the community. That's one of the key features of the program. What are the benefits to the individual? We've already said that very high probability of a good job when you come through the program. But on a personal level, you can gain a thorough grounding in nutrition science and really understand what's going on with nutrition and what happens in the body. Develop a holistic approach to obesity and malnutrition in the modern world, and combine a variety of approaches to understand this, both at the sort of molecular biomedical level and also what's happening in society. And the knowledge and skills you gain on this will enable you to engage with people across the spectrum, from the general public, healthcare professionals, nutritional scientists, and also people within industry. And to reiterate, we are world leaders in this area, and we've got a large number of expert teachers who will instruct on the course, both within UCL itself and within our partner hospitals, which include UCLH, the Royal Free, and also Great Ormond Street. This is just a quick overview of how we structure the program. So in term one, we teach on Wednesdays and Fridays. The modules we got split up here. So students on the Clinical and Public Health Nutrition course will take the fundamentals of health and nutrition. They will then go on to take disease-related malnutrition, and students on the eating disorders course will not do disease-related malnutrition. They'll do eating disorders clinical science instead. On Fridays, we teach a research method and practical nutrition assessment throughout term one. In term two, clinical public health students will have therapeutic aspects of nutrition, followed by nutrition and public health. If you're in an eating disorders program, you will not do nutrition and public health, you will do eating disorders instead. On Friday teaching, it's malnutrition in the community, followed by disease and disordered eating. However, if you're on our obesity and clinical nutrition program, your Fridays are made up of obesity and public health, and then obesity and weight management. So there's a lot of core modules that all of our clinical nutrition programs study, which you can see here in blue, and then the other colors relate to the specific programs, which you'll hear more about in a moment. We have a good mix, a diverse mix of teaching methods. We've had to be adaptable, and we have changed our approach in a number of ways as a response to the pandemic, and some of these have been very successful, and we're retaining them going forward. So the idea of doing flipped classrooms, where we present lectures online first as videos, and then we have workshops to discuss them, has been very successful, and we'll be retaining quite a lot of that going forward. We do a lot of problem-based learning. These are very popular. We do these as workshops with lots of interactive quizzes to go with them. Peer instruction is very good. This is where people will actively use their skills to teach each other. We do a lot of clinical case-based approaches and a lot of coursework. So there's not an awful lot of exams in the program. A lot of it is coursework assessed. Everybody does a research project. We can talk more about that if you wish to, but the number and the variety of research projects is basically just dependent on your imagination and what you would like to do. We have laboratory practicals, as I said. We have simulated activities. We have field trips out to see nutrition in the community and in other hospitals. And again, we do still have some lectures. I'm happy to answer any questions now, or to hand over to my colleagues to go on and explain the differences or the specialties of our other programs.
I can't see any questions in the chat at the moment, but I think if we hand over to Paul and then we'll go to Anastasia. Thanks, Nathan. It was an excellent presentation.
Thank you.
Hello, everyone. I'm just looking for my PowerPoint. Should be there. Oh, here it is. It's appeared at last. Okay. Well, I'm Paul Robinson. You see me on the top right there. I'm program lead for this for the eating disorders degrees and certificate and diploma. This all started well, more than 10 years ago now, when I went to the people who were running the clinical and public health nutrition degree at that time. It was not only Nathan, but also Professor George Grimble and Professor Alistair Forbes. And I said to them, I've been in eating disorders all my professional life, been a consultant psychiatrist, and there isn't a proper course on it. They very kindly said, okay, we'll help you. And so we created this new degree in eating disorders and clinical nutrition, which I'm going to tell you about today. Just to run you through the various people, you've already met Nathan. There's Erica playing the violin there. She also lectures and teaches, and she's the associate program lead for the degree. John Roche is a module lead for one of the modules. It's called MEDC 0041, which is eating disorder clinical science. And Darren Coutinho, both he, Eric, John, myself, and Darren, and also Tayyib are all consultant psychiatrists in eating disorders. Oh, sorry, that's jumped a bit. So Darren is also a consultant psychiatrist. He's a child psychiatrist, and he's a course tutor. And Tayyib is also a psychiatrist in eating disorders and also a course tutor. So that's the team. And we started, as you see, in 2011 with no students. Then we had 2, and we went up from there to a peak in 2018. And then that was 36 students at that time. And then COVID sort of took over, and we obviously had a dip, but it looks as though we're flattening out from that, and hopefully we'll continue our previous. We don't want to double the numbers, but we don't mind having a few more. So at the moment we don't actually have a limit on the number of people allowed onto the program, but I guess that would happen if too many applied. So these are the results you get from this degree. This is from all the eating disorders and clinical nutrition students. Very few fails. This is all of them over the past 10 years. Very few fails, relatively few passes, merits, and even more distinctions. There was a couple of students who didn't manage one of the modules, so they couldn't get the degree, but they were given another degree because they'd done enough work. And one important thing, I don't know if you're interested, if you're applying to us from a psychology or another non-biomedical degree background, that we found no difference at all between the students who do have a biomedical degree, such as nutrition, and the ones who don't. So you do have to work very hard if you don't know about things like the Krebs cycle, but all of the students we've had have done it, and I'm very pleased about that. So the decisions, Nathan told you about the research project, all sorts of subjects we've had, qualitative studies, quite a few qualitative studies. There's been a community study, there's been systematic reviews, there have been one on Chinese medicine, some people do studies in their home country, back in wherever you come from, and Marzipan is the document about severe treatment of severe anorexia nervosa, and that's been studied, and even yoga and eating disorders has been studied. We've had a lot of people accepted as abstracts. Their abstracts have been accepted at conferences, and we've had a couple of papers published in the last year from students. Here's one of them, Isabella Robinson, no relation to me, but she was a student on the course, and she wrote a paper which was published in the European Eating Disorders Review, which is the major European journal on eating disorders, about the caregivers' experiences of eating disorder treatment. And this other one, which we have the senior author here, or the first author anyway, sorry, Sarah, which was about a test of muscle function in risk assessment in anorexia nervosa. Also been published in the European Eating Disorders Review. Okay, just going through the modules. The first module in the first term is Eating Disorder Clinical Science. Now that will take you through the causes of eating disorders, the classification of them, aspects to do with the psychology, with the physical problems, and all the things apart from treatment that are important in eating disorders. In the second module, which we're going through at the moment, this is about management, and it's management in every sense. Therapy, individual therapy, group therapy, family therapy, looking at different therapeutic aspects. We rely very much on the NICE guidelines, and we have people talking on each of the NICE guideline recommended therapies, and often we have the people who develop them. In this course, just as in Nathan's course, we have people who've written the books here. So you meet the top people in eating disorders in our course. You have a clinical attachment for 3 days during term 2, and in term 3 you do the dissertation, which I mentioned. And the other modules in the degree, which are really the ones shared with Nathan's clinical and public health nutrition course. There's fundamentals of nutrition, there's therapeutic aspects of clinical nutrition, there's malnutrition in the community, there's disease and disordered eating, there's practical nutrition assessment, and at the bottom is experimental design and research methods. So you get a really broad view of nutrition in addition to specific specialized treatment of eating disorders, their causes, consequences, and their treatment. Okay, we do have exams, I'm afraid. As Nathan said, not that many. We do have multiple choice exams, and we rely on the 5-item single best answer approach. We have short answer questions, and they tend to be problem-based. So we will describe a clinical case or a problematic issue and ask you to comment on it. And then there's a dissertation, which we mentioned, and there's a poster presentation. So you choose a subject that you're interested in, and you present it as a poster, as if it was a conference. And your final mark is an aggregate of the module marks, plus a small amount from the poster presentation, a large amount from the dissertation, and a small amount from your tutor. So is there life after it? If you want to work with patients, although you do become a registered nutritionist, as Nathan said after this course, generally we advise getting a clinical training if you really want to work in the NHS or any other health organisation with patients. You can work as a registered nutritionist. There's no problem with that. But you get further if you have a clinical training as well, such as medicine, dietetics, psychology, clinical psychology or counselling psychology, mental health nursing, or occupational therapy. But there are other careers, and there's research careers. We've got lots of our students in PhDs, doing PhDs, entering teaching, and as I've mentioned, the association. So in conclusion, this is a demanding but fascinating course. Our results have been excellent, including students without a biochemistry background, so don't let that put you off. The dissertation allows you to pursue a clinical laboratory study and maybe to get published. Okay, that's that.
Thanks very much, Paul. Over to you, Anastasia.
Can you see my first slide?
Yep.
Yep.
Great. So good afternoon, everyone, and welcome to our open day. My name is Anastasia Kalea, and I'm the academic program lead for the MSc in Obesity and Clinical Nutrition. And today, in the next 10 minutes or so, I will go through the structure of the curriculum, our vision behind this program. It's the second year it's running this year. And I will touch a little bit on some of the key topics of our obesity research. So around 1.25 million people in the UK are thought to be living with obesity and overweight and eating disorders. Over half of adults in the UK are now classified as overweight or obese. So understanding diet, nutrition, and its wider impact on health is essential. This program was created to offer specialized training in the clinical and scientific basis of overnutrition and obesity, and in public health measures and therapeutic approaches that aim in prevention, but also in treatment of obesity. And I have to say that we're proud to claim that no other university is able to offer such a wide range of high caliber partners and experts, both scientific and clinical, in the field of obesity. Our students have the opportunity to be involved with some of these partners, and that includes the UCLA Bariatric Center for Weight Management and Metabolic Surgery, the NIHR Obesity Policy Research Unit, the UCLA Institute of Epidemiology and Healthcare, the behavioral scientists in our university, and the Bartlett faculty. One important barrier that we have identified to impede optimal care delivered to patients living with obesity is weight bias and stigma. And perhaps if I had to identify the vision behind the creation of this program, that was it. So this MSc was developed to teach future healthcare professionals about that unrecognized transmission of attitudes and beliefs that are related to patient care, and teach professional values in clinical training that would affect the way patients are treated. So such an approach through our curriculum, we aim that it will affect the way people would treat patients, people living with overweight and obesity, and therefore we're hoping that it will affect the quality of clinical management of this chronic disease. Now, some of the key facts, why obesity? Well, it seems to be a disease that affects quite a lot of people around the world. So worldwide obesity has nearly tripled since 1975. In 2016, more than 1.9 billion adults over 18 years of age were reported to live with overweight. Of these, over 650 million people were living with obesity. Most of the world's population live in countries where overweight and obesity kills more people than underweight. And based on that kind of evidence that exists in prevalence and trend data, and the epidemiological evidence linking obesity with a range of other comorbidities, other health conditions, physical or psychosocial, it's reasonable to describe obesity as a public health emergency. So this is the reason that we need to look at the quality of care that we offer to the people that live with this disease, and to look a bit more carefully about our national healthcare and prevention strategies. And it's that that multidisciplinary, that intersectoral action that is necessary to manage and prevent such a difficult problem. You've seen one of these images before in Professor Davis' presentation, which shows what is happening in the UK. So around 2/3 of adults in England are classified as living with overweight or obesity. And in England, the proportion of the adults who were categorized as people living with obesity increased from 30% in 1993 to 27% in 2015. That has only been aggravated after the past years with the pandemic and the series of lockdowns. The rate of increase has slowed down since 2001, but the last 2 years, the the first data that we have from the National Diet, the National Child Measurement Program are not very optimistic. The prevalence of obesity is similar among men and women, but men are more likely to be overweight. Now, why do we talk about excess weight? Well, it seems to have an impact in overall health and morbidity, other comorbidities that would affect quality of life. This is a slide that was borrowed from Professor Butterham, who's the research lead in this MSc, and that slide presents all that great number of medical conditions that are associated with obesity. We have overwhelming evidence on that association between increased adiposity with insulin resistance, glucose intolerance, diabetes mellitus, hypertension, dyslipidemia, and a series of other diseases that would affect quality of life. And all of these are associated with obesity. And an approach that we follow in our public health nutrition modules specifically is based on that complexity of a problem like obesity. This image is from a report produced by the UK government's Foresight program on tackling obesities. And what this report did, they developed scenarios of the future to explore how the UK could respond to rising levels of obesity. That's the obesity systems map, and even though sometimes is derided for its complexity, it has been instrumental in creating a far more balanced perspective around the roles of the individual and the environment. So the individual is only one component of this program, of this problem. We see that the food consumption, the individual psychology, the individual's biology or their activity levels are highly linked with the environment that the individual lives at, the opportunities for activity that are presented by this environment, the food production, the societal influences that the individual of the society the individual is living in. The independent contributions of a poor diet and physical inactivity as drivers of excess weight gain, and they need to take into consideration the biology, but also the wider impact, the impact of the wider environment that the individual lives in, and which would affect their personal choices. So in this MSc, we are training students in many different aspects. So our goal is for our graduates to develop a thorough grounding in the theory and application of nutrition in prevention and treatment of obesity and its complications. And we expect them to gain a good understanding of the causes, the current best practice for treating overweight and obesity as observed in clinical practice. And by the time you graduate, you are expected to be knowledgeable in public health nutrition issues and strategies that are employed at national, but also at local levels. And we do offer quite a lot of specialist knowledge that is related to research on obesity, state-of-the-art methods that are employed at the moment, and look at therapies, complications, health risks, and these are linked to the research projects that you will be asked to develop, and that comes towards the, as you saw in the other programs, towards the last part of your studies. So our curriculum follows in the modules that we developed, and they're specific for the obesity and clinical nutrition MSc students. We talk about the different levels of managing weight. So we talk about prevention of obesity, but also obesity strategies for that focus on lifestyle interventions. And we talk about specialist services and bariatric surgery when we talk about different severe forms of obesity. And following this approach, we developed some bespoke modules for this program. So our students undertake modules to the value of 180 credits. And this program consists of 8 compulsory modules of 15 credits each, and a dissertation that will give you 60 credits. There are no elective or optional modules. All modules are level 7 modules, and they're compulsory. So you can see here in purple color, find my pointer. In purple color is the modules that are shared with other nutrition MSc programs, the ones that Professor Davis presented, so fundamentals of nutrition and metabolism and disease-related malnutrition. These run on a Wednesday in the beginning of term 1. In the beginning of term 1, this one, and towards the second part of term 1. And on Fridays, we have the practical nutritional assessment module and the research methods module. And these are all shared with other nutrition MSc students. And then in term 2, we start with a shared module on therapeutic aspects of nutrition on Wednesdays on the second part of term 2. The first part of term 2, we offer a bespoke module on obesity and weight management. And here we talk about behavioral aspects of weight management approaches, but also we look at the whole spectrum and we talk about bariatric surgery and treatment options there. And then on Fridays, we run the obesity and public health nutrition module and the disease and disordered eating module, which is shared with other MSc students. We also, part of the obesity and weight management module, we offer visits to clinical settings. In the past, because of COVID-19, we had a lot more online clinical sessions that students could observe. We had discussions with patients to share their experience during their treatments. Slowly this year, we started having some clinical observations, which is fantastic, and we're optimistic that this will continue, because this is really useful in order to appreciate the barriers in offering weight management services. The research projects are variable, so I don't expect you to be able to read all of these. This is some examples from last year's research projects. They're around clinical trials that we're running at UCL, their systematic reviews, their online questionnaires that we're collecting data from patients that are undergoing obesity treatments. There are different studies, and we always encourage students to come up with their own ideas. UCL has a wide range of researchers. And for instance, this year I had a student that was interested on food marketing for children living with obesity, and we were able to find experts that could, from UCL, that could supervise a student project on that. And that's something that we enjoy doing, because students get, when they get to follow their passion, the projects are really interesting. Thank you for your attention, and I'm happy to answer any questions.
Thanks very much, Anastasia. So we will go to the Q&A segment now. I can't see any questions in the chat at the moment, but I do have some questions that were submitted prior to the event. So happy to kind of start with those, and then equally, please chip in any questions you have throughout. We're here to answer your questions. So the questions that we have are: what are you looking for in a successful applicant? I think this question perhaps was across all programs. There wasn't a specific one. So I don't know, Anastasia, perhaps if you want to start?
Well, the application has to meet the admission criteria, obviously, to go through the admissions process at UCL. But something that grabs our attention would be somebody that appreciates the program, I guess. So looking at the personal statement and understanding why is somebody interested in this program, and explaining what led to their decision is always useful. Strong recommendation letters, a strong scientific background. I have to say that we do teach a lot of metabolism. We do teach a lot of, we expect somebody to have some kind of exposure on biomedical sciences. So it always helps them, helps the students do a little bit better in the modules that will follow.
Fantastic. I don't know, Paul or Nathan, do you have anything you'd like to add?
Yeah, I can say.
Paul,
carry on, Nathan.
Paul, do you want to go first?
Okay, all right. Well, obviously I go through all the applicants and I read all their personal statements, and I'm shocked by how often nobody mentions eating disorders in their personal statement. I can't understand why you would apply for our degree and not explain how you're completely addicted to learning about eating disorders. So that's the first thing I want. And the second thing, as Natasha says, it's a tough degree. With I think ours is particularly tough because there's a lot of psychology in it, as well as a lot of biochemistry. So it's incredibly broad, and so you've got to have a very good intellect to be able to cover that. And so we're looking for people who are bright, and that's why there's the 2-1 requirement in the admissions. I don't think I've ever read a bad reference, but very, very occasionally. So I don't find references that useful, especially as the referees never mention eating disorders either. I think the personal statement is really important. And increasingly, if I'm unsure, I will contact the applicant and have a conversation on Zoom with them, which I've been finding very, very helpful indeed.
Thanks, Paul. So definitely personal statement seems to be the #1 focus.
Yeah, I think it's fair to say that we see a lot of sort of identikit personal statements. Somebody Googles, how do you write a personal statement? And you can almost see that being copied and pasted in. I think for the most part, we'd rather read a shorter personal statement that was more personal, rather than people trying to cram in everything that they see on a sort of tick list from a website somewhere. So, something that says about you, something that says about your particular interests and your passions is far more engaging and far more likely to win you a place on the program than reams and reams of stuff that you think you have to tick every single box of an imaginary list.
Well, actually, we have a successful applicant with us. So, Sarah, you probably are the expert to give an example of how you approached the application process, and perhaps some advice for those considering making an application.
Yeah, definitely. I think for me, when I was applying, so I came from a very clinical nutrition and dietetics background for my undergraduate. So I was more focused on the psychology behind eating disorders. So I think when I tailored it at my personal statement, I discussed all the qualities and skills that I do have that I think will make me be successful in pursuing that master's, but also what I'm actually looking forward to gaining. So explaining that I have all the scientific knowledge, but I maybe lack the psychology, which is why I'm applying. So I think being very honest and very personal with what you actually can provide and also what you're hoping to gain, that to me is the way to be successful in your personal statement.
Yes, sounds like honesty is the policy.
Could I just make one more point?
Yes, please.
Hopefully this will be seen by lots and lots of people around the world when it's up on the website, because you don't need to say what a wonderful place UCL is. We know. And some people spend half their personal statement congratulating UCL on being a wonderful place. talk about yourself and your interest in the subject.
Can I add something to this? I always enjoy when I read personal statements, and there is some part there that talks about what the student thinks that they could contribute to this program, and I'm talking about their background and how they could offer their experiences to their classmates, and thoughts of how this training, this MSc, would help them towards their career aspirations.
Yeah, definitely. I think as well, it's that community. What are you going to? What does the applicant want to get out of being part of the community, the program? So yeah.
Could I just say one more thing?
Yeah, of course.
Sorry to ramble on, but a lot of people who have had the experience of an eating disorder have applied for both our course and also the other nutrition courses. And I'm very sympathetic to that. I do understand why having had that experience, or someone else in the family having had it, could make you interested in it and want to know more about it, maybe even want to treat it. I would advise against coming to this course, certainly our course, if you've got an active eating disorder, if you're still ill with it. We have had the occasional student who slipped in like that, and it can be very triggering and very difficult. So if you're thinking about it and you're not sure, go and speak to someone, speak to a doctor or a psychologist or someone, just about the implications for you of going for a degree like this.
Thank you, Paul. So I've just checked the chat and the Q&A. So we haven't had any more questions live at the moment. So I might power through my other questions and give those for you to ponder on. So we've got a question about the teaching delivery. So in terms of, obviously, I think with the pandemic and conversations around policies and guidelines changing, do you think there'll be, will the programs have a hybrid approach to teaching delivery, or are you working more towards in-person? So I don't know, maybe Nathan, if I can pass that one to you first.
Yeah, sure. So we have tried to maintain in-person teaching as much as we possibly could. It was over the last 2 years, other than the periods of absolute lockdown, we've always striven to ensure that we maintain some in-person teaching, whether that was just workshops and a few discussion classes, or actually sort of getting back into delivering more sort of traditional teaching. So where we are at the moment is we have around about 50-50 blend. So about half of the program is online, and that's either with sort of pre-records or with live delivery, but an online setting. So as you see, we are very adept at using Zoom and Teams and all these type of systems these days. And they work very well. And we have got lots of additional tools that we use as well to supplement them. So we use online sort of quizzes and presentation and surveying software as well in order to stimulate engagement, to get feedback, to sort of delve in and try and understand that make sure that our messages are getting through. So I think moving into the new year, we'll probably still be working at around about a 50-50 mix of online and in-person. So the way it works at the moment is we tend to teach 2 full days a week. I expect we'll move into the new term in October, with one of those days being made up of online teaching and the other day being in-person, face-to-face. But as both Tessa and Paul said, this is a busy course, and people don't get off lightly. The other days of the week, there is still plus stuff to catch up on. There are assignments to do. There's reading to do. There'll be other videos and things to watch. We certainly keep our students busy and engaged, and there's lots and lots of content in the course, and you can certainly fill up your days doing that. But we'll see exactly how it goes. It may be that we move back to a slightly higher proportion of in-person teaching. But where we are at the moment, I think probably that 50-50 split will be the way we go, at least at the start of the new year.
Great. Paul or Anastasia, do you have anything you'd like to add or is it taking a similar approach?
Yeah, no, I very much endorse what Nathan said, but I just wanted to add that I found the online bit, the transfer to online teaching, really quite educational for myself, because you don't have the students in the room with you. They can go off and make a cup of coffee if you're being boring, and you won't know it because they never turn their cameras on. And so I've had to develop myself in different ways, and UCL's been really helpful. I've been on various teaching courses at UCL, and it's been, as Nathan mentioned, having online quizzes is really a good way, I've found, to break up a lecture and also make it more interesting and engaging. So I think the 50-50 split is, I hope it's here to stay, because I quite like the opportunity to do this.
Yeah, I couldn't agree more. And that the approach this year, which was not 50-50, but it gave opportunities to have the more theoretical content in a recording, let's say, and start from there to do something more fun and interesting in the face-to-face sessions, or plan in some modules clinical observations around them and reflect on them and have discussions. So I felt that the student experience by combining the two modes of teaching delivery was which was much better, was improved. So yeah, I think that would be a nice way around.
Yeah, and I guess it adds a layer of creativity as well on top of that. So yeah, and skills. Moving everything online is really good in terms of just for our own technical skill development. Sarah.
But that's sorry, just to add though, I mean that's also come through into our live teaching as well. So a lot of what we do, a lot of the sort of survey-based stuff and quiz-based stuff, and, everybody has one of these days. So you can't actually go, here's my phone.
Yeah, and it's a lot of fun.
So engaging people, even people who don't really want to put their hand up, they will quite happily join in and give feedback if it's just pushing a few buttons as opposed to raising their hand and feeling a little bit shy sometimes.
And I was just going to say, Sarah, I don't know from your experience and obviously teaching delivery, how did you find obviously studying under the conditions of I assume it was probably the transition to online when you were studying?
So I did the course between 2018 and 2019. So it was when
you just
yeah. But I'm a big fan of lectures being recorded pre-hand or being recorded completely, because then you have the opportunity to go through it in your own time and at your own pace, whereas in face-to-face, a lot of benefits, but also it being online, you just go at your own pace. You can go back and it's not as intimidating as being in a lecture where you might not feel comfortable asking the lecturer, interrupting them in between for questions. So I think both have positives. I think a 50-50 balance is really great.
Yeah, I think hopefully there's something for everyone in that kind of environment. So yeah, that's a really good point. We still haven't had any other questions in the chat. So I've got one more question that was submitted prior to the event, but if anyone does have a question, please do feel free to either raise your hands, put something in the chat or the Q&A function. We're here to answer those, but this next one's actually a really nice question, which I enjoy when this one comes in, but it is asking what inspired you to go into your careers. So it would be, let's go with Anastasia to start.
So my training was as a dietitian from a BSc, and that so I studied in Greece, and then I did my PhD in the US on nutritional physiology, and worked on cardiovascular disease after that. But before entering university to study nutrition and dietetics, I was training for a biomedical degree, and that was the time that I felt that light bulb moment that hold on a minute, if we can use food to prevent disease, maybe that's a very good investment versus treatment. And while studying nutrition, the second light bulb moment was when one of my professors presented data on how improving malnutrition in patients in hospital care would decrease the time they stay at the hospital and their quality of life and their recovery. So I thought, hold on a minute, there's so many things we can do to get this right. So I think that's what set me off to this path, and yeah, kept me since.
That's fantastic, very inspiring. But how about Paul? What inspired you?
Yeah, it's very different. I mean, I was a doctor. So I was actually at UCL Medical School, and I thought I was going to go into medicine and neurology, and I did 5 years postgraduate medicine as a registrar. And one of my jobs, the Queen Squares said, yes, you can be a neurologist, but go and be a general physician first. So I went off to King's in South London, and I was a general physician rushing around, putting tubes into people and electrodes and things like that. And one of my jobs was to go across the road to the Maudsley Hospital to give a medical opinion on the psychiatric cases there. And I started getting interested in the whole psychosocial aspect of disease. And I decided at the end of that year to transfer into psychiatry from medical, because I was already qualified in medicine. My second job in my psychiatry training was the professor of eating disorders. And he immediately sent me off to America to do some research. And I was caught then. I had the bug.
Wow, that was an exciting opportunity.
Yes.
Nathan, how about you?
Well, I started off training as a biochemist, and my first degree was in biological medicinal chemistry, and then I went on to do a PhD in research. And but while I was doing my PhD, I ended up switching supervisors, for all sorts of reasons. But the person that I started working for was very heavily involved in medical research. So I largely did my PhD around intensive care and septic shock, which is sort of very serious bacterial infections. I then carried on, and I became more medical as I went along. I postdoced looking at babies who were born, blue baby syndrome, babies that were born hypoxic, and understanding what was going on, and trying to find identifiers as to which babies were going to get very, very sick, which babies were going to sort of essentially shrug it off and become healthy again. So I was doing a lot of medical things, and all the things I was doing were revolved around sort of infection and inflammation. So then I had an opportunity to essentially came to work at UCL, and I joined the liver disease research team. A lot of things I'd done sort of similar, a lot about infection immunity, and I started working there. So very heavily in research and sort of medical aspects of it. And of course, the thing about the liver is the central metabolic point of the whole body. Everything that happens, that chemistry in the body, pretty much happens in the liver. So everything you eat, everything you drink, everything you do ends up going through the liver. So I was doing a lot of this work, and then my predecessor, George Gimble, who started these programs, as he was setting up these courses, asked me if I was interested in teaching about metabolism, and I sort of got the other bug, as Paul said, he got the research bug. I sort of got the teaching bug in a way. I was already doing a little bit of teaching of various things, but I sort of became more and more involved. And over the last 15, 16 years, I just progressively got sort of more involved, and I enjoy teaching. That's the thing. We all like to think that our research is going to save the world, but in reality, we'll have much bigger impact by educating, hundreds of people who all go out and change the world in their own way. And so, if we can find a way, we're the snowflake that hopefully starts the avalanche.
I like that. That's a very strong message at the end. And Sarah, obviously you've completed the course and you're on to very exciting plans for your future career as well. So I don't know if you wanted to share a bit about what inspired you to take the path that you've chosen.
Yes, so I did my BSc similar to Anastasia in nutrition and dietetics, and we had one lecture, I think, in that whole degree on mental health and eating disorders. And I think that's when it sparked that, oh, this is really interesting to me. I finished the degree and then I wasn't ready to work, and I really wanted to know and learn a little bit more about eating disorders, which is how it led me to doing the master's at UCL. And the last 2 years I've been working as a dietitian. So in my first year, I was an eating disorders and mental health dietitian, and then moved on to a different rotation. And now in September, I'm going to be going back to university, and I'll be studying medicine as of September.
Yeah, and also congratulations again on that. Exciting. So I can see that we haven't had any other questions in the chat or the Q&A, but equally, if anyone does have any questions beyond today's event, please do feel free to reach out to Paul, Anastasia and Nathan. We'd be delighted to hear from you. But yes, I think in terms of today's events, I just wanted to say thank you so much to our speakers for your excellent presentations. We do have a very short survey at the end of this event, so if you would be able to spare a few seconds just to fill that out for us, that would be really appreciated. And also thank you so much, Sarah, for coming along and helping with the Q&A part of today's event. Fantastic. Well, thank you so much, everyone, again, and hope you have a lovely evening.
Thank you. Bye-bye. Bye, everyone.
Bye.
And thank you for sharing so expertly.